Welcome to today's Explainer. We are tackling a seriously fascinating subject right now. We're looking at the literal plumbing of the human heart, specifically the coronary arteries. If you've ever stopped to wonder how the absolute hardest working muscle in your entire body sustains itself every single minute of every day, well, you're in the right place. So let's jump right into it. Think about this fundamental paradox for a second. The heart pumps blood out to the whole body, right? But how does it pump blood to itself? It's really easy to just picture the heart as this mechanical pump pushing gallons of blood out to our limbs and organs. But the heart muscle itself, the myocardium, it desperately needs its own dedicated nonstop supply of oxygen and nutrients just to keep beating. If that supply gets cut off, the whole pump stops. Here is our quick roadmap for today. We're going to cover the heart's blood supply, trace the branches of the right and left coronary arteries, figure out the whole right versus left dominance thing, and finally, look at what happens when this plumbing fails. All right, part one, the heart's blood supply and those very first branches. The coronary arteries are sometimes called the vasa vasorum, which literally translates to the vessels of the ascending aorta. They pop up right above the aortic valve. So picture this, the exact moment freshly oxygenated blood leaves the left ventricle and shoots into the aorta. The absolute very first branches to pull from that rich supply are these coronary arteries. They run right along the surface of the heart, tucked into the subpericardial tissue, directly feeding the heart muscle. Moving on to part two, let's actually map out the right coronary artery branches. Let's treat this like a GPS route for the right side of the heart. The right coronary arteries start specifically at the anterior aortic sinus. From there, it threads its way forward between the pulmonary trunk and the right auricle, and then drops straight down vertically into the right atrioventricular groove. Now, on its way down, it gives off a really important branch called the right marginal branch. After that, it hooks around the inferior border and heads to the back, right into the posterior interventricular groove. It is an incredibly precise anatomical routing just to make sure the right side gets exactly the fuel it needs. Okay, part three. Resetting back to the aorta, let's map out the left side. So the left coronary artery kicks off from the left posterior aortic sinus, and almost immediately it splits into two huge vital branches. You've got the circumflex artery, and you've got the anterior interventricular artery, though honestly in the clinic, you're almost always going to hear this called the LAD, or left anterior descending artery. The LAD travels right down the left side of the ventricular septum. It carries a massive workload, and as we're going to see in just a minute, it has a pretty notorious clinical reputation. Part 4, right versus left dominance. Who actually rules the heart? You know, human anatomy isn't exactly a carbon copy from person to person. When you hear cardiologists talk about dominance, they're really just asking which major artery gives birth to the posterior interventricular artery. For about 90% of you watching this, you have right coronary dominance, meaning that vital branch comes right off the right coronary artery. But for the other 10% of people, it's left coronary dominance. In their hearts, that exact same branch comes off the circumflex branch of the left coronary artery instead. Kind of makes you wonder which side of the statistic you fall on, right? Finally, part 5. We're shifting from anatomy to the heavy, real-world stakes. What happens when the plumbing fails? The stark reality here is that just like the pipes in a house, this system can get completely clogged. Atherosclerosis, which is the buildup of plaque, narrows these essential little highways. And the thing is, these blockages do not just happen randomly. There are very specific danger zones. So where do you think the major traffic jams happen most often? Check this out. If we look at the 3 most common sites of occlusion, the circumflex branch gets about 15 to 20% of them. The right coronary artery sees about 30 to 40%. But the LAD, that left anterior descending artery we talked about earlier, a staggering 40 to 50% of all blockages happen right there. And because the LAD feeds so much of the left ventricle, which is the main powerhouse pumping chamber of your heart, a blockage there is absolutely devastating. It is super easy to see why it's so notorious in medicine. When a blockage starts causing trouble, it usually falls into one of 2 clinical realities. First up is angina pectoris. This is basically a narrowing of the artery that causes ischemia, or reduced blood flow. The key thing here is that it typically happens when you push yourself, like during a workout, and the pain can actually radiate down the medial side of your arm, up into your jaw or your neck. It's like a warning light on your dashboard. On the flip side, you have a myocardial infarction, which most of us just call a heart attack. This is a total, complete roadblock. Blood stops, the tissue actually starts dying, and a terrifying hallmark of this is that it can happen when you are completely at rest. Now, you might be asking yourself, doesn't the body have a backup plan for this? Well, actually, it does. They're called anastomosis. Think of them as the heart's built-in backup generators. They're these tiny physical connections between the terminal branches of the coronary arteries, way down at the microscopic arteriolar level. But, and this is a massive but, time is absolutely everything. If a blockage builds up slowly, over months or years, those little arterioles have the time they need to widen out and create a natural detour, collateral circulation. But if a plaque suddenly ruptures and causes a rapid clot, no chance. The backup generator completely fails because it literally didn't have the time to turn on. When nature's detour fails and the block is severe, surgeons have to step in and basically act as master plumbers. Enter coronary bypass surgery. Step 1. They harvest a healthy graft. Usually they'll take the great saphenous vein from the leg or the internal thoracic artery from inside the chest. Step 2. They stitch one end of that graft right into the ascending aorta, tapping directly into the fresh blood supply. Step 3. They connect the other end past the obstruction. They literally build a physical bridge, shunting the blood right around the traffic jam to save that starving heart muscle. I want to leave you with this really profound insight from our source material today. Anatomically, coronary arteries are not end arteries, but functionally they behave like end arteries. Because a sudden blockage just doesn't give those backup anastomoses time to work, the artery functionally becomes a dead end, and the consequences of that are immediate and life-altering. It really makes you appreciate the incredibly delicate balance keeping us alive right now. So how well are you treating the plumbing of your own heart? Definitely something to think about. Thanks for joining me for today's explainer, and we will catch you next time.